It's my pleasure to introduce to you our next speaker. She's from my home state, Illinois. She received her medical degree from Indiana University. She's board certified in family practice and integrative and holistic medicine, and is a director and owner of True Health Medical Center and Pure Compounding Pharmacy in Naperville, Illinois. She specializes in biomedical interventions for children with ADD, autism, PANS, and Down syndrome and related disorders. She's researched copper, zinc imbalances, metallothionein dysfunction, biofilm-related infection, and hyperbaric oxygen therapy. She serves on the advisory boards for Talk About Curing Autism, Generations Rescue, and Autism Hope Alliance. Please give a welcome to Anju Usman.
So I know I'm talking to a lot of dentists out there and people who may not think that the microbiome is that important, but you guys just heard David Quigg speak, and how many of you guys kind of felt like, wow, that was a lot of information? Well, what I want to try to do is take some of that information that is so important that he taught us and make it a little bit more clinically relevant to you. And even though I'm coming from this autism world, I want you to guys think about the microbiome and how it may be relevant, not just to your patients, but to yourself and to your families and to what maybe you're dealing with in your own lives, because we all want to be healthier, right? So when you guys think about yourselves, how do you think your brain is functioning right now on a scale of 1 to 10? Are you guys all 10s? Yeah? The ones in the back are. So we have this concept of a healthy gut is a healthy brain. So how many of you guys think you guys have a healthy gut? Just a few of you. There's like one person here that has a healthy gut. So then you must have a healthy brain. So what is it that creates a healthy gut, and why don't we have a healthy gut? What's going on with our microbiome or our microorganisms in our body and in our gut? So what we're saying is that the gut microbiome interfaces with the central nervous system. How do you guys think that does that? How do your gut bugs affect your brain? How does that work? How does the gut-brain connection work? How does that work? Does it work through neurotransmitters? Yeah. Does it work through the endocrine system and hormones? Yeah. Does it work through the vagus nerve? Yeah. So all of those types of interfaces occur with the gut-brain connection. So we're learning that chemicals can affect our microbiome. We've learned that metals can affect our microbiome. And when they affect our microbiome, what happens to us? So a lot of the new research is really on how this alteration of the microbiome can lead to autoimmune conditions. And that different bacteria in the gut, for instance, a bacteria we learned about earlier, Bacteroidetes, can cause inflammation and lead to autoimmunity. Things like lupus, multiple sclerosis. We even find that periodontal disease and periodontitis, when patients with those types of things swallow this abnormal microbes, it can affect their GI microflora and lead to things like rheumatoid arthritis. So there's a lot of new research coming out on how this microflora affects autoimmunity. You guys know about some of the research on how our microflora affects obesity. When you look at people now, do you think they look different than they looked 20 years ago or 30 years ago? Do you guys have a sense that people are more obese? Even the younger kids, even the kids in high school, you can kind of see they've got a little bit of extra belly fat, and there's something going on with their blood sugar. So the theory behind this one is your diet, antibiotics, alter your bile acids, they alter your short-chain fats, and then they create an abnormal gut flora that produces something called lipopolysaccharide. Lipopolysaccharide is pro-inflammatory. It causes leaky gut and a leaky blood-brain barrier. That affects how we metabolize sugar, It affects how we feel hungry or don't feel hungry. And all of this leads to chronic inflammation and what we call pre-diabetes, metabolic syndrome, and even diabetes. So the gut microflora is really important for that as well. I mentioned how the oral bacteria in our body affects the microbiome of the gut, and then this could lead to issues with intestinal bowel disease and gastrointestinal disease, and it's all coming from the oral microflora. And then colon cancer is another one that they're finding that overgrowth of certain bacteria like E. coli and Bacteroidetes fragilis, when we have an overgrowth of these types of good bacteria, then that puts us at a higher predisposition or a higher incidence of having something like colorectal cancer. So right now we can use tests that we have to kind of look at these, and now they're going to create biomarkers for some of these kinds of issues as well. So my world is the autism world, and there's some players in that world, like Dr. Adams, who's done a recent fecal transplant study on my patients. Have any of you guys heard of that one? Yeah. Well, Dr. Adams gave a subset of patients with autism oral poop pills, have you will, and with those oral poop pills, he was able to improve their autism symptoms. So Dr. Adams and some other famous people in my world, like Dr. McFabe. Dr. McFabe is the doctor out of Canada who injected mice with propionic acid. Do you guys know where propionic acid comes from? Clostridia infections or anaerobic infections. And you guys can test a propionic acid level in like an organic acid test. So Dr. McFabe injected these mice with propionic acid, and he looked at what was happening in their brain. They ended up with oxidized glutathione, a lot of oxidative stress, a lot of neuroinflammation. The mice didn't socialize, and they had autistic-like behaviors. So these people got together and they kind of came up with a consensus. And they said that we can maybe manipulate the gut microbiome to help patients with autism. And the same holds true for manipulating the gut microbiome for patients with obesity, for patients with cancer predispositions, patients with autoimmunity. But how do we do that? You know, what does that actually mean? So we're going to talk about how we might be able to do that and manipulate that microbiome in all of us and in our families. So you guys know about the Human Microbiome Project. You've heard about the Human Genome Project. When you think about your genes, do you realize that there's more genes in the microbes in your body than there are that you have? The microbes in our body exceed our human genes from 10 to 1 for a 10 to 1 ratio. And these microbes are not just bacteria. They're protozoa, they're yeast, there's viruses, parasites that make up our microbiome. And it's not just the gut. You guys know about the oral microbiome, but there's a microbiome on our skin, in our urogenital area, in the nose, and they all vary. So when you think about your stool, what do you think it's made up of? What gives it its bulk? What do you think? I like to ask questions, so I know you guys aren't asleep. What's in your stool? Fiber? The number one thing that makes up your stool is bacteria. So if you think the amount of bacteria that's in your stool, think about the amount of bacteria that's in your gut. At least 100 trillion bacteria, at least 1,000 different species. So this disruption of the microbiome that we talked about, what would that lead to? And what does that bacteria in our gut do? What does it do for us? One of the most important things that it does for us is it digests fiber. And it takes that fiber and makes something called short-chain fats. And short-chain fats are fuel for the gut enterocytes, the gut cells. And these short-chain fats are really important for a healthy gut lining. And we need that healthy gut lining so we don't have leaky gut and we don't have a leaky blood-brain barrier. So the major component of your stool is bacteria, and the bacteria in our body helps us digest and absorb nutrition. It also produces B vitamins. So if your flora is abnormal, you're not going to produce the right amounts of B vitamins for your body. We learned today that some bacteria can destroy toxins, and it can help with the detoxification of pharmaceuticals and chemicals. It helps with blood sugar regulation. It helps with immune and inflammatory issues, and it helps with the balance in the nervous system through the vagus nerve. So if you guys think about what might disrupt a human microbiome, what are some of the things that you can think about that would disrupt our biome? Why are we all in trouble? Why does none of us have a great microbiome? Glyphosate, antibiotics, sugar diet, mercury, toxins. Did your mom breastfeed you? Dr. Bowie, he's from Mass General, and he wrote this article about etiological factors. So moms who have autoimmunity, that changes the child's microbiome. Moms who have had viral infections or fever during their pregnancy. Small babies or premature babies have an abnormal gut microbiome. Were you a vaginal birth versus a C-section? Did your children, were they born from a C-section? Did they start off their life without the right microbiome? What kind of dietary factors did you have? Do you eat a lot of fiber in your diet? Did you get a lot of antibiotics? Food sensitivities and allergies. Now, in his article, he didn't talk about the chemicals that we're also worried about, like the glyphosate, the metals, like the lead and cadmium and mercury. I think stress plays a huge role in what's going on in the microbiome, too. And there's studies to show that it can affect food poisoning. That can lead to something called SIBO, a small intestinal bacterial overgrowth, that I'm going to talk to you guys about. Any kind of infections in the gut, gastroenteritis, and this concept of hygiene hypothesis. That can disrupt our microbiome too. So we know from various studies, and Dr. Quigg did a really good job of explaining some of this to us, is that chemicals can affect the microbiome. Heavy metals, chemicals, air pollution can all affect the gut microbiome in adverse ways. Glyphosate, he talked to us about that, how glyphosate affects sulfation. And we need those sulfate molecules. Remember, he was talking to us about how that mucus in the large intestine is really important, and that mucus is sulfated, and that sulfate gets disrupted with the glyphosate. And glyphosate affects our neurotransmitter production through effect with our amino acids like phenylalanine and tyrosine and tryptophan. And it interferes with our cytochrome P450 system, which is involved in phase 1 liver detoxification. And so Stephanie Seneff is the big researcher on glyphosate, and she says that this is probably one of the big potential causes of things like obesity, diabetes, heart disease, autism, cancer, and Alzheimer's. It's quite scary. How many of us don't have Roundup in us? 0. The same holds true for the heavy metals. I know we're worried a lot about mercury, but the whole Flint, Michigan thing and the water crisis there, do you think those kids or those people there with lead in their system had lead toxicity? What do you think? Or did they have lead burden and lead exposure over a long period of time? And that lead burden and the lead exposure affected them not only neurologically, but could also affect their microbiome through effects with oxidative stress, nitrogen metabolism, detoxification, vitamin E metabolism, and again in this particular study. And it wasn't lead toxicity that does it, it's just lead exposure. So when do we develop when do we establish our microflora in our gut? What do you guys think? Day 1, day 2? Really early on, yeah, day 2. And what is that dependent on? Some of it's dependent on your genetics, the way you're delivered, but a lot of it is dependent on the food. And a lot of it is dependent on whether you were breastfed or formula fed. The minute you're formula fed, different bacteria are going to grow in your gut. And it's going to go towards things like E. coli and Bacteroidetes. And E. coli and Bacteroidetes are pro-inflammatory, even though they're good bacteria. So again, just by formula feeding our children, we're going to create this pro-inflammatory situation in the first few days of life. And how does that manifest in a lot of our patients? So what do you guys think about what's going on with this whole coronavirus? You guys are all sitting here, right? I think that's a testament to the type of people you are and what you think about it. However, we have to take precautions, and we want to be hygienic. We want to have good sanitation. I noticed that people weren't hugging as much as they usually do, or kissing me on the cheek, or anything like that. However, too much of it isn't a good thing either, right? We know that too much hygiene can increase the risk of having things like autism, asthma, allergies potentially. So we want to be hygienic, but we also don't want to overdo it. Have any of you guys seen this particular graph? So let's see. Can you see my arrow? Yeah? So in this corner, we have third world countries, and we have a high parasite load. This top of the graph here, we have first world countries with the low parasite load. These are the countries that have the highest incidence of Alzheimer's. So the highest incidence of Alzheimer's is in countries with the highest amount of sanitation and hygiene. So how do we restore this microbiome that we've talked about is disrupted in pretty much all of us, and is disrupted in some of our patients more than others? What can we do? I know you all know about the environmental controls, the soaps, the shampoos, the detergents, the cleaning agents, those types of things. Let's talk about dietary approaches, probiotics, prebiotics, and some ways to address dysbiosis and SIBO. So let's talk about that. So to restore the microbiome, one of the most important ways we can do that is through diet. And the type of diet is important, because what we need for this is we need a diverse microbiome. We need a little bit of a lot of the bacteria. We don't need too much of anything good, and we don't need too little of anything good. So the way we do this is with a high fiber, plant-based diets. And if you think about the big fad diets out there, like the keto diet, or these really, really high protein diets. When you have a high protein diet, that might help one thing, but it may create another whole big issue of other problems that I'm going to tell you about. So again, to restore our microbiome, what do we need? We need a good, diverse diet, plant-based, high fiber. We need to avoid antibiotics at all costs, avoid GMOs and glyphosate. Pharmaceuticals such as oral contraceptive pills and nonsteroidal anti-inflammatories can affect our microbiome. And the overuse of hand sanitizers and antibacterial soaps can also affect our microbiome. So the diet can rapidly alter the human gut microbiome, and it does it through gene expression, which is really interesting. So how long do you guys think that it would take to change your diet, to change your microbiome from a pro-inflammatory microbiome to an anti-inflammatory microbiome? How long do you guys think that would take? A month? A year? It takes 6 days. So you think you guys can change something for 6 days? You think you can manage that? That's not too bad, right? It's not months, it's not years, it's just 6 days. It's hard to give up that wine for 6 days. So, they did this study to compare the diets of children in Europe versus the diets of children in Africa. And again, the diets of children in Europe, you would think, would have more refined carbohydrates, less fiber, less vegetables, and pro-inflammatory. The diet of children in Africa, higher fiber, lots more vegetables, lower incidence of inflammatory bowel disease, lower incidence of inflammatory conditions such as allergies and asthma based on just their diet. So this is, I know it's hard to see unless you guys have that little app, but I just kind of wanted to point out a couple of things. So if you eat a very rich animal-based diet, you are going to increase some short-chain fats. And remember, these are good for feeding your gut lining. But what happens is then you will shift your microbiome towards feeding certain kinds of bacteria versus others. So if you have a high plant-based diet, you're going to create more isovalerate and isobutyrate. If you have more of a plant-based diet, you're going to produce more acetate. And these kinds of diets affect glutamate as well, and glucose regulation. So the key point here is overconsumption of anything is going to feed certain bacteria. So overconsumption of dairy, for instance, feeds a sulfur-reducing bacteria called biophilia. Now, the sulfur-reducing bacteria likes sulfur, so it likes dairy. But if we overfeed it, it's going to overgrow. And then what ends up happening is you end up with something called sulfur SIBO. It's small intestinal bacterial overgrowth of a sulfur organism, and that likes sulfur. So you eat eggs and you get bloated and you get gassy. Or you eat something with a lot of sulfur like garlic or onions and you get bloated and you get gassy because you're feeding this bacteria more and more. So this is a sulfur reducing bacteria. It's called biophilia. So we can test this. We can do tests to figure out what's going on in the microbiome. You can do a stool culture, and there you're trying to culture pathogenic organisms that could be causing problems. But it's not telling you about this balance between the good and the bad bacteria. So now they have new tests called DNA probes, where they can probe the stool and look at what type of good and bad bacteria that you have in your gut. And so those can be really helpful. You can run inflammatory markers on the stool, like calprotectin and lactoferrin. You can look at digestion and absorption markers in stool testing. In the urine, we can look at organic acid testing to look at breakdown products of fungus, yeast, and Clostridia. And they can be helpful to kind of figure out what's going on in there. There's also breath testing, where people are given lactulose or galactose, and then we measure what type of gas is coming out of their mouth from the bacteria that's using those sugars to produce that gas. And that's a way of diagnosing things like methane SIBO, hydrogen SIBO, or sulfur SIBO. And then there's some newer blood tests to look at IBS. The CDTB is a toxin produced after an infection, and if patients with IBS have this toxin still in their gut or in their stool, then we're worried that they still have some type of chronic infection in the gut. If they have antibodies to something called vinculin, then we're worried that maybe after incidence of food poisoning or some type of infection, that now they have an autoimmune condition in the gut, and that's harder to treat, causing problems with motility. So here's some examples of when you do like a DNA probe in the stool and you get the different types of bacteria. You can kind of look at those bacteria and say, okay, what does this mean? So I mentioned that if you get a DNA probe and you see that there are high levels of Bacteroidetes and Prevotella, this leads to lower diversity of other bacteria. It could lead to things like inflammatory bowel disease and obesity. Same with Prevotella. Another very important bacteria is Clostridia. And so, that's anaerobic. I mentioned it's associated with some of the children with autism, but it's associated with pretty much anybody who's had lots of antibiotics, because they will overgrow Clostridia, which is an anaerobic bacteria. Lactobacillus species, we all know, is important to have. It causes richness in our diversity, but lack of lactobacillus can lead to inflammatory bowel or, IBS. So looking at this stool, different microbes in the stool kind of help us figure out what's going on with our patients. For instance, if they have low levels of Roseburia, then they're more likely to have things like non-insulin dependent diabetes, IBS, or inflammatory bowel disease, or even rheumatoid arthritis. So we'd like to see those levels of Roseburia higher. And if they don't have them higher, then we need to do something to kind of manage that microbiome. We want to see high levels of bifidobacteria, and low levels are associated with weight gain. Low levels are associated with allergy. Bifidobacterial longum is another really important one for weight. Desulfovibrio is a sulfur-reducing bacteria, and high levels of that are associated with bowel disease as well. Oxalobacter is important for breaking down oxalates. So many of our patients or our family members might have kidney stones. And if they have kidney stones and they don't have this bacteria, then again, working on the microbiome would help them improve levels of this and improve their ability to handle oxalates in their diet and not form calcium oxalate crystals. So you guys kind of get the feel for that, right? I know it's a little technical. So looking at these bacteria is important. Dr. Quigg mentioned the Akkermansia we can't even pronounce these, Musophilia. Anyway, low levels of Akkermansia are associated with diabetes, Crohn's disease, prediabetes, autism, and obesity. They did a study where they gave patients metformin, and it helped improve their Akkermansia levels. Now, I don't know if they improved their Akkermansia levels because the metformin helped them with blood sugar regulation and therefore that helped their microbiome, or that the medicine actually helped with the microbiome, but it did improve the level of this bacteria in the gut. So what do we mean when we talk about microbiome overabundance? It's overabundance of some of this good bacteria, like Bacteroidetes. Bacteroidetes species produce LPS, lipopolysaccharide, and they can be pro-inflammatory if overgrown. We mentioned Clostridia species are the same way. We don't want too many of those, even though some of them are good. That can create neuroinflammation. And we don't want too much of our sulfur-reducing bacteria, because not only do they like the sulfur in our food, but they like the sulfur in our bile. And they'll steal our bile, so we can't digest and absorb our nutrition the way we should. And they'll also steal our butyrate, which is important for healing that gut lining. Then we have microbiome depletion. Now this is depletion of some good bacteria. So this would be, it would look like low levels of lactobacillus on your testing, low levels of bifidobacterium. Low levels of enterococcus on testing is associated with dysautonomia. And I know a lot of our patients have that type of syndrome going on with lots of anxiety. And then we mentioned some of these other bacteria. So here we go again with the Akkermansia. Low levels of Akkermansia can damage the gut, create oxidative stress, create inflammation, and cause type 2 diabetes and problems with not enough ability to feel full. A lot of these patients never feel full. They're always hungry. So again, managing the microbiome may help them with this. We can use probiotics such as Lactobacillus and Bifido. Lactobacillus casei and vulgaris help to decrease gut permeability. They help make some of those mucin, those mucus-producing proteins that are important for that gut lining. So they help to reestablish that nice film or glycocalyx. They also help with Th1, Th2 skewed immune systems, so they help to balance things like allergies, and they increase that anti-inflammatory cytokine IL-10, so they can be very helpful. Lactobacillus salivarius and acidophilus can change our pain response. So patients who have a lot of pain, over the top kind of neuralgia, Lactobacillus acidophilus and salivarius can help by improving cannabinoid receptor expression. And so they may be helpful. Here's some examples of some other probiotics. Probiotics that can help with diarrhea, Lactobacillus rhamnosus GG. Probiotics that help with reflux, really helpful one is Lactobacillus reuteri. And then probiotics that help with anxiety. Two of the most famous ones are Lactobacillus helveticus and Bifidobacterium longum. So again, when you're picking species of probiotics to use, you want to use specific types of species, and you want to use them for whatever you are looking for to help yourself or your patients. There's a list of different ones to help with constipation and eczema. One of my favorite probiotics is Lactobacillus reuteri. They've done some studies in children where it actually helps with socialization, but it also is important for things like allergic issues, inflammatory bowel disease. It helps with the mucosal barrier function in the gut lining. It helps with T cells in the gut, and it helps Th1 and Th2. Skewed immune systems. Have any of you guys heard of Lactobacillus gasseri? So they did this study in nurses, and it decreased body fat by 8% after using it for 12 weeks. So that's an interesting one to consider trying. I like to rotate probiotics because they do different things for the body, but it's also nice to know what's going on before you start. So like I said, the testing can be really helpful. It can also help with things like asthma, menstrual pain, endometriosis, and H. pylori. I know the dentists in the audience, have any of you guys used Streptococcus salivarius? It's a strep species, and in the literature, it helps recurrent pharyngitis and recurrent streptococcus and recurrent otitis media by 90% with a 3-month trial of that. So I deal a lot with patients who have recurrent strep. My patient population sometimes develops something called PANDAS. Any of you guys have heard of PANDAS? It's pediatric autoimmune neuropsychiatric disorder associated with strep. In this case, the children get strep. They don't get a sore throat or a fever or the usual symptoms of strep. They develop OCD, anxiety, anorexia, and tics. And when they get another episode of strep, these symptoms get worse, and it becomes an autoimmune condition. So oftentimes in those families, I'll have the family members take the Streptococcus salivarius to prevent strep carriage in the nasopharynx so that they aren't carrying the strep and reinfecting my patient. So it's something to think about in a patient who gets recurrent infections or might be carrying strep. Oftentimes with the strep salivarius, you can get it comes as a chewable as well. So it's very palatable. Another type of bacteria that is really interesting to consider using are spore-forming bacteria. The spore-forming bacteria always start with the word bacillus. So Bacillus subtilis, Bacillus coagulans. They're a little different because they get deep into the GI tract, they produce a spore, and once they get there, they release beta-carotene. So they act as an antioxidant deeper in the GI tract, and they have an anti-inflammatory effect. They also help decrease lipopolysaccharide, which is, again, so pro-inflammatory, and they help degrade biofilms. So again, back on this idea of probiotics, there are different ones for different things. There are probiotics that we call D-lactate-free. There are certain bacteria that produce lactic acid, and we don't want to give those types of bacteria to patients who have mitochondrial dysfunction or mitochondrial disorder. So those, like Lactobacillus rhamnosus, would not be a good choice in a patient with mitochondrial issues. There's also patients with histamine issues. So there are good bacteria that produce histamine, and so we wouldn't want to use things like Lactobacillus casei, reuteri, or bulgaris in our patients with histamine issues. Now I put these genes up there, the HNMT, MAOA, and COMT. These are SNPs, and patients who have these SNPs have an issue clearing histamine from their body. And so again, you don't want to add the histamine load to their system by putting in a histamine-producing probiotic. There's also some bad bacteria that produce histamine. So if you do a stool test and you see high levels of things like Klebsiella and Citrobacter and Enterobacter, some patients will just get red cheeks and red ears just from the dysbiosis and the bacterial overgrowth from those particular bacteria. Now, some of the good bacteria that degrade histamine, so again, you have a patient with allergy issues and you're trying to pick a probiotic, you might want to pick a probiotic that has Bifidobacteria longum, Bifidobacteria infantis, which is also antiviral. And then those of you guys who like wine out there, Lactobacillus plantarum in wine can degrade histamine. It's the sulfites in the wine that make you get that histamine reaction, not the bacteria. You guys still with me? Yeah? I don't want to talk over your heads. So how many of you guys know of the term symbiotic? Symbiotic is the combination of a prebiotic and a probiotic. So prebiotics are that fiber that we talked about, that fiber that's so important that these probiotics chew up and make short-chain fats out of. And so prebiotics are certain types of foods that are high in this type of soluble fiber. Foods such as artichokes, chicory root, onions, leek, garlic, raw oats, bananas. These are foods that the probiotics and the microbiome bacteria, the bacteria in our gut, need to stay healthy and alive. So these prebiotics help us with our digestion, and they help us keep that pro-inflammatory process under check. So again, they fuel the short-chain fats, and those big short-chain fats are butyrate, acetate, and propionate. Now, what are some examples of prebiotics? When you guys look at, other than food, you guys look at supplements. Some of them will say FOS, fructooligosaccharide. That's a prebiotic, and it's fructose-based, and it's coming from things like chicory or inulin or agave. Then there's a probiotic that is GOS-based. Sorry, prebiotic. The GOS-based prebiotics are from lactose. And then there's MOS from glucomannan. Have any of you guys tried konjac noodles? They're called no noodles. They're called no noodles because they don't have any carbs. They're just this prebiotic from this flour called konjac flour. And it's a nice way not to get carbs, to get a noodle, and to feed your good microbiome. So glucomannan is an MOS. And then there's insoluble fiber, which are things like psyllium husks and those flax seeds and things like that. And then there's soluble fiber like arabic gum and pectin. Lactulose is also a prebiotic. And then another prebiotic that they're products of is called PHGG, or partially hydrogenated guar gum. And what they're finding is these different prebiotics will feed different types of bacteria. I'm not going to go into which ones feed which bacteria. It gets a little bit boring. But Again, we're talking about variety. We want a variety of a lot of these different things because they're going to feed a lot of the different types of bacteria. So we really want a lot of good short-chain fats, and one of the most important short-chain fats is butyrate. Butyrate has a lot of clinical applications in in our practice. I think the best way to create butyrate is by feeding the gut the right way. However, there are butyrate type supplements, and butyrate is anti-carcinogenic, it's anti-inflammatory, it's well, it helps with obesity, it helps the cardiovascular system, it helps balance the immune system, it's neuroprotective, and it upregulates stem cells. I think you couldn't get anything better than that. But it tastes nasty. Have any of you guys ever tried butyrate? Did any of you guys take chemistry in high school? Did you ever make scents of things, like in any of your labs? Did you ever make like the scent of pineapple? You had to use butyrate to make the scent of pineapple, and it smells like throw up. Yeah, it's exactly like throw up. So it's not a fun supplement. So again, we want our gut microbiome to eat fiber and to make our own butyrate. So these these microbes are always playing a game in our gut. And they're trying to fight for, the throne, have you will. No pun intended. So which one is going to win? Which one is going to win? The good bacteria, the bad bacteria, which one? So the terminology gets a little crazy. So as I've talked to you guys about lack of good bacteria, that's depletion, too much good bacteria, overabundance, too much bad bacteria, dysbiosis, loss of microbial diversity, which is a lot of this. And then we have SIBO, which is small intestinal bacterial overgrowth, and SIFO, which is small intestinal fungal overgrowth. So I'm going to talk to you guys a little bit about that, just to make the soup a little thicker. So SIBO, small intestinal bacterial overgrowth. So the symptoms of this are those patients who wake up in the morning and their tummy is flat. By the end of the day, they're distended and bloated, or they get distended and bloated after eating carbs or sugar, or foods that are high in fructose and fructans or fiber. Any of you guys ever feel that way after you eat a lot of carbs or sugar? That's that bacteria chewing up all that food, creating gas. Now this can cause abdominal pain, it can cause gas, it can actually inhibit gut motility. So a lot of these patients have what we call gastroparesis or dysmotility. The bacteria in the small intestines is actually good bacteria, and it should be in your large intestines. But because the motility is weak, it ends up in the small intestines and it overgrows. So theoretically, it's not bad bacteria. And so if we do things to squelch it, like if we kill it, or we don't feed it, it'll grow back unless we deal with the whole microbiome and get things back in order. So this bad bacteria, or this overgrowth of bacteria in the small intestines, produces different kinds of gas. And if it produces a methane gas, it causes constipation. And if it produces a hydrogen gas, it causes diarrhea. And if it produces hydrogen sulfide, when people pass gas, it smells like rotten eggs. So it's not pleasant. So what causes SIBO? Because I see it a lot in my patients, even the young ones. So overuse of antibiotics can lead to this, overuse of antacids. The most common cause is post-food poisoning or post-infectious. Toxicity can lead to SIBO. Glyphosate is potential for this. Alcoholics, hypothyroid patients, diabetics, patients with immunodeficiencies, anatomical issues can all potentially develop SIBO. What's the long-term effect of this? Well, it affects the the production of bile and into the small intestine, and it causes malabsorption of fats and fat-soluble vitamins. It can lead to things like malnutrition, low globulin, low albumin, low cholesterol, nutritional deficiencies. And again, I see this a lot in my patient population. You might not see it in an older population as clearly. Poor weight gain, chronic inflammation, leaky gut as well. So the mainstream treatment for SIBO is antibiotics. And what we find with these patients is they'll take a 14-day course of antibiotics and they'll feel a lot better. But unless they work on rebalancing this microbiome, a lot of these symptoms come back, and then they need another course of antibiotics and another course of antibiotics, and then we play this vicious game again with the antibiotics. So elemental diets, these really low FODMAPs diets, prokinetics can also help with some of this. So we can maybe look at it from an integrative level. We can look at it from an integrative approach. What else can we do? Well, we can lower the bacterial load that's in the small intestines with these antibiotics. We can even potentially use antimicrobial herbs like oregano, berberine, neem, garlic can help. We can use different types of protocols to kind of rebalance the microbiome. In this patient population, we don't want to overdo probiotics, and maybe use things like lactobacillus and spore-forming type of bacteria. We do want to address this carbohydrate maldigestion, so for a short period of time, these patients need to be on a very low carbohydrate diet. They may need what we call a low fructose or FODMAPs type diet. They would have to avoid high fiber foods and avoid fermented foods. And then work on their gut motility with things like prokinetics, vitamin C, magnesium, lion's mane, things like that. So overall, what can we do to kind of help this overabundance, depletion, lack of diversity, dysbiosis, SIBO, SIFO? So again, cleaning up that environment, cleaning up the diet, cleaning up the gut, using digestive enzymes, probiotics, prebiotics, and working on that dysbiosis. So, old way, new way. I've done some of you guys have probably heard me talk about biofilms, and I talk a lot about them because in my patient population, I see a lot of recurrent infections. And when I treat these infections like candida or strep, a lot of my patients feel a lot better, they get better. But then the infection comes back, and then they have a regression again. So one way to kind of approach these chronic infections is that some of them are hiding under these films, and we can kind of degrade that film. Now, there's the good mucus and then the bad mucus. There's these pathogenic films that we need to degrade for a short period of time, but then we need that good film to kind of grow so we can maintain that gut flora. So we can work on breaking down these films with some various things, and that's called lysis. We can use various herbs to kill the bugs that are hiding underneath these films, and then we can use a binder to clean that all up, and then work on nourishing the gut lining to build that up. A lot of what I learned from biofilms is actually from dentists. The first time I actually heard this term is when I was in a dentist's office, because the dentist's office I was at was using some enzymes to clean the tubing of their equipment of these biofilms. And so you guys understand what this is more than most. So we can use things like enzymes to break down this film, and the film is made up of mucus, which is saccharides, and protein, which is a little bit of fibrin. So saccharide-bases, mucolytics, fibrinolytics, even things like pineapple and papaya can break these kinds of films down. One of my favorite things to do is apple cider vinegar and honey and a little bit of baking soda. That can be very helpful for films in the mouth and in the upper GI tract. Lactoferrin is a supplement that can help kind of break apart a biofilm. And these films are held together with calcium. It's kind of like a fortress. And this fortress is hiding these bugs, and the fortress is made of iron and calcium and some magnesium. So if we pull calcium or iron away from this fortress, we can poke holes in that film. And so iron chelating compounds like green tea can be helpful, curcumin, IP6 and acetal, various polyphenols and essential oils also have these kinds of properties to pull apart these films. So this is called lysis. And then we can use various herbs to kill the microbes underneath. So again, when we do this type of testing, we see bad bacteria. We can use various antimicrobial herbs to help with the candida, to help with the gram-negative bacteria, the gram-positive bacteria, and use it alongside these enzymes. Well, when you kind of open up this film with all this bacteria and this mucus, you're kind of left with that sitting there. And that can be very disruptive and can cause some irritation. So we can use a binder to kind of bind up all this detox and die-off. And the various binders can be extremely helpful when you're killing bugs. So use things like activated charcoal, bentonite clay, yucca, chlorella, cilantro, zeolites, cholestyramine. I even like castor oil. So these all can help with some of this detox and die-off. But I think the most important step in all of this, and kind of like the take-home message, is that to restore that microbiome, we need a diverse diet. And we need to pick better choices when we eat. We need to reincorporate things like herbs and spices in our diet because they provide a lot of different phenols and polyphenols and terpenes and different things that can help restore some of the bacteria. We need to use different types of oils and kind of shift our dietary choices from more animal-based to plant-based dietary choices. We can use high fiber type of plants so that we're not getting the carbs and the sugars that none of us really want. Polyphenols in our diet are really important, and even things like soy isoflavones, they can change the microbiome. There's some bacteria that take the soy and produce something called equal, and equal is a product of the soy degradation that helps women postmenopausally. It has mild estrogenic effects, and it helps, without giving a hormonal effect, it helps balance hormones. So again, using prebiotics, using probiotics. How many of you guys are into juicing? Some of you. That's a really good way of getting some of these foods, diverse types of foods, into your diet without having to eat a whole lot. Just be careful if you have a history of oxalates or you have that low oxalobacter in your stool test, because a lot of those greens, especially spinach, are high in oxalates and can lead to kidney stones. Things like bone broths and collagen, they help with that sulfation, they help build that mucus layer back into the biofilm, and so those types of things can help reestablish that good gut lining. So bone broths can be helpful, collagen, fermented foods, going back to some of those kinds of concepts with eating more of our traditional types of foods. So again, I just want to leave you guys with this message. Every time you eat or drink, you are either feeding a disease or fighting it. So thank you so much for your attention.